Hello, everyone. Welcome to Research America's Alliance discussion. I'm Jacqueline Lagoy, and I'd like to thank you for joining on Zoom today and for your partnership in the Research America Alliance. I hope everybody is looking forward to this discussion as much as I am. So today we are happy to be joined by Dr. Howard Zucker, Deputy Director for Global Health at the Centers for Disease Control and Prevention. He will discuss the CDC's work abroad and how it is instrumental in protecting the health of the United States and the international community. Please type your questions into the Q&A box or chat, and we will pose as many as we can during the Q&A portion of today's session. Thank you so much for joining us, Dr. Zucker. Over to you.
Good afternoon and Happy New Year. I'm excited to be here. Thanks to Jacqueline for organizing this and for the introduction and moderating the Q&A later. I look forward to answering all your questions. I want to start by sharing some ideas today that I've been thinking about for a long while now, in the hope that they might lead us to thinking about solutions in different ways. Next slide. Before coming to public health, I worked as a physician for many years, and one of the most heartbreaking things to see is that frailer patients tend to get even sicker. We know that when a person's body is already out of balance, it's easier to tip the scales in the wrong direction. A grandmother with emphysema is more likely to die from flu than a 30-year-old marathoner. And our bodies are constantly meeting new threats we have to fight off. For example, every time we touch a grocery cart handle, or as any parent knows, when your preschooler sneezes, we worry. And this is a good analogy for global health. The world is like a body constantly under attack. We have a group at CDC that specializes in using event-based surveillance to track health threats all across the globe. On any given day, they're monitoring between 30 to 40 different public health threats globally from various media reports and stories. Just last month, they tracked concerning outbreaks of dengue in Costa Rica and Mpox in DRC. And it's alarming because, unfortunately, the world right now is more like the grandmother than the athlete. Next slide. If we were to do a clinical exam and put our metaphorical stethoscope up to the globe, we'd discover that it's out of balance. It has some underlying conditions that are making it harder for public health to save lives. Big issues that make it more difficult for us to do our job by demanding our already scarce resources, exacerbating existing health problems, and creating entirely new ones. In medicine, we know you can't treat a condition effectively until you diagnose it. So what are the conditions our global patient is suffering from? Next slide. The first thing our examination reveals is that the world has a chronic fever. Next slide. In 2023, the world saw the highest global temperature in over 150 years of record keeping. As temperatures rise, so can premature deaths from ozone and particle pollution and heat. We see more flooding, and with that, increases in risks of waterborne diseases. Milder winters, warmer summers, and fewer days of frost make it easier for diseases to expand into new geographic areas and infect more people. Changes in temperature, rainfall, and humidity alter the environmental suitability for the transmission of many mosquito-borne diseases such as dengue, malaria, vibriosis, and West Nile virus. Next slide. We're already seeing it. Just take a look at some of the recent headlines. Last fall, the New York Times published a whole set of features on how the mosquitoes are winning, highlighting how the transmission season for malaria is lengthening in many regions. And last summer, the United States reported locally acquired malaria cases for the first time in 20 years. Next slide. Right now, CDC is closely watching the spread of Anopheles stephensi mosquito, which thrives in urban areas and could put 126 million more people in Africa at risk. We're also watching the spread of dengue. The Caribbean Public Health Agency reported a 15% increase in dengue last year compared with the previous year. In the United States, California reported its first 2 locally acquired dengue cases, and Florida a record 138 cases, more than doubling the prior year's numbers. And the Lancet reported that the transmission potential for dengue is expected to increase by 37% by mid-century. But as I mentioned, it's not just mosquito-borne threats. Next slide. In 2022, Pakistan suffered from floods brought on by a severe heat wave, which caused glaciers in the mountains to melt and heavier than normal monsoon rains. With 1/3 of the country underwater, the floods devastated much-needed immunization infrastructure and displaced 33 million people, half of whom were children. 1,700 vaccination sites were destroyed, and immunization coverage dropped dramatically. Flooding also served as a medium for spreading diseases like cholera, dysentery, dengue, malaria, polio, and skin infections. And in the face of events like these, public health has to work harder to reduce suffering and save lives, to reach the child who is more risk than ever from vaccine-preventable diseases at a time when they are harder than ever to reach. To win this fight, we need more tools in our toolbox. That's where research comes in. Next slide. For example, through our decades-long partnership with Kenya Medical Research Institute, or KEMRI, we worked on the development and adoption of the first malaria vaccine less than 2 years ago. The data was so strong that it led to the early release of recommendations to implement the new RTS-S vaccine. 40+ years of partnership between CDC and KEMRI is driving even more waves of innovation, including studying the effectiveness of monoclonal antibody products like the NIH product L9LS as a tool to help children in high transmission settings. But nature will not make it an easy battle. These shocks can continue to derail public health's good work through supply chain disruption, migration, and antimicrobial resistance. All these impacts that have the power not only to change our future, but to reverse our progress if we don't take action right away. Next slide. But for now, let's get back to our global patient. Examining our world, we discover a second underlying condition, an untreatable infection. Now consider that Alexander Fleming discovered the first antibiotic, penicillin, in 1928, at a time when the world's population was less than 1/3 of what it is today, and commercial air travel wasn't yet commonplace. Antibiotics were the superhero of the 20th century, saving millions of lives around the world from bacterial infections, including pneumonia, foodborne illnesses, and healthcare-associated infections. In fact, I believe it saved my mom from a ruptured appendix when she was a little girl, if not for antibiotics. Today, we're losing this miraculous ability to treat and prevent even the most common infections. In 2019, antimicrobial resistance bacteria were estimated to cause more deaths than HIV or malaria worldwide. We know now that antibiotic-resistant germs can share their resistance genes with other germs and can make them untreatable. Given the chance these germs will infect our bodies, take up residence in our healthcare facilities, and contaminate our food and water supply, and move across our communities and around the globe. That's why antimicrobial resistance, AMR or just AR, is something CDC and the international community are highly focused on for 2024. In fact, in September, the UN will hold a high-level meeting on it. There's really no place, no region, no country that it doesn't touch. Next slide. Again, here are some headlines from just the past month or so. In a recent CDC MMWR report, scientists discovered that in Ukraine, the combination of high pre-war rates of AR, the increase in the number of traumatic wounds, and the war-related strain on healthcare facilities is leading to increases in antimicrobial resistance infections. More than half of the hospital-acquired infections they found were from organisms resistant to last resort antibiotics, known as carbapenem-resistant organisms. These are much higher rates of resistance than those reported by the European Union in 2016 and 2017. Another recent headline, last fall, multiple media outlets reported that an increase in mycoplasma pneumonia transmission, along with other common respiratory viruses, were overcrowding China's hospitals. Children who get mycoplasma pneumonia infections usually have the signs of a chest cold, And the lay public know this as a walking pneumonia, and up to now, it's been treatable with antibiotics. Periodic epidemics of mycoplasma are expected every 3 to 7 years. However, just like with the other infections, it's becoming increasingly antibiotic resistant. A May 2023 study found that in Beijing, the bacteria was between 70% and 90% resistant to commonly prescribed macrolide antibiotics. This is a problem not just in China, but across the globe. South Korea and France also reported increases in mycoplasma pneumonia this year. And it's easier than ever for resistant versions of the bacteria to hitchhike with international travelers and find their way to anyone's doorstep anywhere in the world. Next slide. As drug resistance continues to evolve and spread, global gains in combating tuberculosis are also at risk. TB is the leading cause of death from an infectious disease. It's also the leading cause of death among people living with HIV. Drug-resistant strains of TB are in every country in the world, with a potential to grow more resistant to treatment if left unchecked, leading to a future where TB is increasingly difficult to treat and to cure. The average cost to treat also increases with greater resistance, so from about $20,000 up to more than $500,000 to treat the most drug-resistant forms of the disease. This is why we're on the front lines in some of the world's highest burden regions, working to understand what's driving the spread of drug-resistant TB and how to stop it, including using a targeted next-generation sequencing assay to rapidly detect mutations associated with drug resistance, and leading laboratory innovations to discover the strain of TB that has become resistant to nearly every drug at our disposal, extensively drug-resistant TB, or XDR-TB. Also noteworthy is that CDC's TB Trials Consortium recently identified the first new short treatment regimen for drug-susceptible TB in almost 40 years, which is incredible progress. Next slide. Detecting dangerous and deadly AR threats is a top priority for CDC. Last year marked the 10-year anniversary of CDC putting out the very first AR threat report. But we've also known that no single organization, no agency, no sector can solve the problem of AR on their own. So we work closely with others in this space. You can see on this map from our 2022 AR COVID impact report that CDC collaborated with more than 100 public and private institutions across the globe to innovate against AR. And in December 2021, we established the Global AR Lab and Response Network, spanning nearly 50 countries and working with more than 20 organizations worldwide. Globally networked surveillance gives us early warning and helps prepare our labs here in the United States for impending threats. And with whole genome sequencing, we've been able to take advantages of some of the global capacity built during the COVID pandemic to identify drug-resistant patterns, mutations, and disease transmission. And this is all work that has to be done together. Next slide. So returning one last time to our global patient, the more we examine, the clearer it becomes that the pandemic has left us fatigued and spent. And we're facing a whole list of underlying conditions. For example, mental health is not doing so well. Life expectancy dropped in parts of the world, including in the United States, and threats continue to emerge and reemerge, underscoring our need to do more. But the good news is that if you can manage underlying conditions, treat them, and get them medically under control, you can reduce vulnerability. Next slide. The time to tackle these complex, long-standing issues is now. To quote President John F. Kennedy, the time to repair the roof is when the sun is shining. So we have a window. We don't know how long, but we do have a window before the next pandemic strikes. So we're looking at how we can use every second to get stronger. Next slide. One of the most significant things CDC does is support 60+ country offices. We're working with ministries of health to build, to modernize, to strengthen health programs that save lives and create a safer world. And so when outbreaks happen, we have boots on the ground and can know what's going on quickly. And in 2024, we have plans to open 2 new regional offices, one in Japan and one in Panama, to grow even closer relationships in more parts of the world. We continue to build health security capacity in more of our partner countries, improving performance on surveillance and laboratory, on disease reporting, on investigations and response. And most importantly, or as importantly, strengthening the workforce. And we're working on initiatives this year to improve early detection and rapid response to emerging threats. Next slide. We've also developed a new global health framework that applies a comprehensive lens across all of our programs, looking at across data, at laboratory and workforce, and also at prevention and mitigation strategies, at public health innovation and research, at health policy, communication and diplomacy, and at program support, which will pull together our best science to tackle respiratory viruses, AR, and many other issues as well. Next slide. And we're tapping into newer capabilities like predictive analytics, genomics, and wastewater surveillance. For example, CDC's traveler-based genomic surveillance program uses airplane wastewater and nasal swab samples of international travelers to detect new COVID variants. And they're expanding to conduct multi-pathogen pilots for early detection of RSV, of flu, and more than 28 other priority pathogens and AR targets. Next slide. In the wake of COVID, we use this gift of time to think broadly about what progress looks like in a post-pandemic world. Progress against not just diseases, but against misinformation and disinformation. Progress on rebuilding the loss of trust in CDC and in public health writ large. That's why CDC is also engaging across the US government and with the world to rethink, to reimagine the policies for how the international community handles pandemics, such as with the international health regulations that every country has to follow, and also partnering with the world in ways we never have had to before, such as with November's launch of a new joint action plan between Africa's CDC and the United States that represents a significant step towards stronger and deeper collaboration. And with the announcement of a $2.5 million investment to help establish an integrated pathogen genomics laboratory in Zambia that will significantly enhance the capacity for rapid and accurate surveillance. Next slide. And of course, I'm personally excited about the road ahead for research and innovation, work that can be done between CDC and the private sector and academic research communities. With all of you here today, we understand the potential of technology to increase the role patients play in their own clinical care. Blood pressure monitors at home or at the local pharmacy, a watch on our wrist that monitors your vital signs all day, insulin pumps, home pregnancy tests, oximeters, and portable defibrillators that are everywhere. I actually have one in my apartment that I keep. All these capabilities we've never dreamed of, even 50 years ago. And now technology is also increasing the role patients play in public health response. For example, you take a COVID test at home, then you use your mobile phone to report a positive test, and you alert others to your exposure or the potential exposures that they may have had. We can think about how to drive this potential even further in the coming year, how to make health more accessible, more available, more affordable, and equitable across the world. Next slide. But it's not just technology we need. We need your big ideas. Creativity is the medicine that will strengthen our personal constitution. This is what I really want to focus on in the coming year. Entirely new ways of looking at challenges, changes in our mindset and our thinking. And it will present us with many opportunities to partner. We know we do our best work when we work together. And if we put our collective minds towards addressing these underlying conditions, we could do our part to set the world back into balance and open the door for a future we can only imagine. Thank you.
Thank you so much, Dr. Zucker, for that fantastic presentation and a great overview of the CDC's work in the global health space. Really quickly, I'd like to invite everyone on the call today to put any questions that you have for Dr. Zucker in the Q&A box or the chat, and we will get to those, try to get to those as many as we can. Really quickly, before I start asking some questions as well, I'd like to thank everyone for joining today and for your partnership in the Research America Alliance. And to remind everyone that if your organization is not a Research America Alliance member, I hope you'll shoot an email to Joel, our Director of Membership, whose email will be put in the chat to discuss joining the Alliance today. So I'll start with a couple questions that came to mind during your presentation, Dr. Zucker. First, a little bit about your background and how that ties into what you're doing now. I'm interested, coming from the background of being trained as a physician, what first drew you to the field of global health, and in what ways does your experience as a physician inform the work that you're doing now?
Sure. So I came to this field, global health, in sort of unusual way. I was practicing medicine. I was taking care of patients, and then I did a medical mission actually over to Asia to help to do anesthesia for children who orphan children, and I realized how health issues were at the center of so many social issues, and how helping one child in one area of the world, or helping many children in those areas of the world, can actually change their life, that individual's life, and the lives of many. And it can work to help communities, and then ultimately work to help countries. And then when I went down to HHS, first as a fellow and then to stay on in the offices there, the secretary had asked me to work on some of the global health work that we were doing. We traveled overseas, and I started to realize that this world is so interconnected. And how we help those overseas really impacts not just our lives, but lives everywhere, and definitely helps impact the lives of those people who are living in those countries. And then ultimately I went over to WHO and then came back, and now I'm down at CDC. And I just think that the pandemic in many ways showed how interconnected we are, and that at the core of our social fabric is really healthcare and health in general.
Yeah, definitely. Sort of to that point, the general public often doesn't hear about some of the biggest success stories that happen in public health and global health, often because there are epidemics and pandemics that didn't happen, or, were averted because of all of the tireless work that efforts, like healthcare professionals working abroad and the CDC are doing. So I'm interested, what is one or, a couple initiatives that the CDC's Global Health Program is working on that you wish that the general public knew more about?
So I think in many ways it's about epidemics that never happened, or we didn't hear about them. So in 2018, 2019 in Brazil, there was yellow fever. It was contained. We controlled it. In Guinea, there was an Ebola outbreak in 2021, and we were able to get that under control within a matter of months. Even in the United States, recently, we've had these malaria cases in Florida, in Texas, and in Maryland. And that was the first locally acquired, as I mentioned earlier, cases in 20 years. And we've controlled it, and we've stopped that, and we've gotten control and watching it. And so we do this, and I think it's all about the power of investing in preparedness, which is so important. CDC has looked at over 400 disease threats that have happened over a long period of time. And some of the things we do is we work in countries to help train those in their country to become those disease detectives. So we have a field epidemiology training program. Over 20,000 people have been trained over the last 40 years in about 80 countries, and they are our eyes and ears. They're out there helping us. So we work with them. And I sometimes think about this, and for those who are in medicine out there, I once was asking the question, how does one measure the effectiveness of something that did not happen, right? Some of these outbreaks don't happen because we've done what we're supposed to do. And so how do we measure that? And it's very hard to do that. And I would say that I try to use an analogy in medicine for those who may think about this, or just in general, people will recognize this. Someone goes in to have their gallbladder taken out. It's a relatively straightforward operation today. Robotics can do it. But they have multiple problems: high blood pressure, heart disease, diabetes, obesity, asthma. And they end up in the recovery room. They feel fine. They're comfortable. They have no pain. Nothing happened. But how do you measure that there was some anesthesiologist, I'm a little biased, I'm an anesthesiologist, but who was working there to make sure that nothing happened to that patient on the operating room table and that they are fine? And that is, how do you measure how effective that was? And in the same way on a global front, how do we measure that we prevented that outbreak from happening? How do we measure that working together, it didn't spread to other parts of that country or to the world in general? So I think that's an important thing that I hope people recognize.
Yeah. On that topic, we're actually coming up on about four years ago that the WHO declared the COVID-19 pandemic. What do you think since then are some ways that the United States is more prepared to address future emerging pathogens, and where do you think that we still have places to improve?
So I think that's a very important issue. And I mean, health threats anywhere and health threats everywhere, right? So we now have global health security strategy. And the goal there is to stop these threats overseas. And CDC works with a global toolkit. We expand disease surveillance so we can catch these outbreaks earlier. We've strengthened our labs to diagnose these problems. We train the workforce. I just mentioned about FETP, but in general, we train the workforce to contain these outbreaks in where they are, and we establish emergency operations as well. So we've seen this with Ebola. We had outbreak of Ebola, several years ago that took a little while to get under control, but then in 2023 in Sierra Leone, we controlled this within a matter of weeks. This is how working together we are able to tackle this. And CDC makes investments in every day. We use this to control tuberculosis. We do this with PEPFAR, the President's Plan for Emergency AIDS Release, the President's Emergency Plan for AIDS Relief, right, PEPFAR. We're working saving millions of lives. That has saved millions of lives over the last 20 years. We do this with immunizations, just routine childhood immunizations. And we also do this with technologies. We work on different technologies and how we use them, working together. So whether it's messenger RNA vaccines or looking at wastewater surveillance, that's another whole area that's really taken off now, and even the monoclonal antibodies for malaria. So we're working by tying all these technologies together, but it really is working together across organizations, across agencies, and then across countries to achieve the goal of a better world.
Awesome. My last question that I have for you is, we all are working in the advocacy arena in some form or fashion who are on the call. I'd love to hear what recommendations you have for scientists and physicians who'd like to engage more in advocacy or work with the general public, on public or global issues.
Sure. So I think that's a great question. And there are so many people who are dedicated and passionate about this. And it's interesting. I was in Washington last night. I took the train up and I was sitting next to someone who is got into medical school, is going to be starting, is trying to decide where she wants to go. And she was in public health before, and she was asking me, or how does she get involved? So this is a whole question for part of a train ride yesterday. And I was saying that it's really important on the physician level to advocate by first advocating with your patients by making sure that they do the right things when it comes to public health, when it comes to preventing disease spread, hand washing, and antibiotics and vaccines. And then on a little broader level with their patients and also with the public in general, to make sure that they recognize that there's a lot of misinformation out there, disinformation out there, and to push back and fight back on that, to say, this is the science, this is the information, this is what we know today, and to carry that message forward and making sure that we educate people the right way. And then also to help in the bigger picture, to work with organizations who have made this their passion, and then to get involved and engage, and particularly those who are earlier on in their career, say, this is what I want to do, and dream big and work with them and sort of say, I'm going to try this. And if it doesn't work after a handful of years, you can move somewhere else. But everything you do, you will learn something that you can then take to the next position you have, but just the next spot in helping our society, and whether it's at a local level, right, with your individual patient or your local community, at a larger level, at a state level, at a country level, or just internationally. And there's so much out there that we can do, and there's so many ways we can help the world. And I'm thrilled that they're the next generation, the generation after, all going to be committed to doing this to help us, because that's the only way we're going to solve some of these problems that I spoke about today.
Well, on that extremely inspirational note, I'd like to ask my colleague Jacqueline to join me, and so we can take some questions from the audience.
Thank you, Tori, and thank you, Dr. Zucker, for a fantastic presentation and a great, wonderful discussion so far. So I'd like to turn to audience questions, and I see that Dr. Tenley Albright has her hand raised. So I will unmute her, see if she'd like to hop on and ask a question.
I would. Well, Howard, that was so informative, and you have done so much since I first met you when you were a White House Fellow. It's amazing.
Right.
And what I wonder is, from the way you presented all this, should we somehow have a larger role of global health in medical school education?
That is a great question. And I was thinking about this the other day because I remember in medical school, there were areas that we did not talk about that now are just commonplace. That we didn't even ask patients sometimes questions that are just part of the routine history. And I said, we got there on those issues. We should be addressing it. And I think that in many ways, a lot of these global health issues are topics that we should be educating the students about, but also for them to recognize that some of these issues are not just in some parts of the developing world, but you can go 200-300 miles from a large city in the United States and see some of those same problems. And I remember talking to a student about this who was thinking about whether going overseas or working in upstate New York. And I said, some of the challenges you may find in some parts of the world are right there, where they don't have enough obstetrician gynecologists, or they don't have enough mental health professionals. And it could be just 200 miles from a large city. But you can learn it both in the United States, but also globally. We should be teaching them that we are connected. And I think that the pandemic gives us an opportunity to see the silver lining from it, which is how interconnected we are, and that students should be enthusiastic to look at it. And I love students because I find that they are the future, and they're enthusiastic, and there's nothing, they don't sort of say, well, there's a challenge here, nothing, there's no obstacle that cannot be overcome. And I think that's a great way to look at the world.
Thank you.
Thank you. Thank you for all that you've done.
Oh, thank you, Dr. Albright. So on to our next question from the audience. Besides surveillance, Dr. Zucker, what is CDC doing to address the COVID-19 ongoing pandemic still occurring outside the US? The ability of COVID-19 to impair immunity against other pathogens should make this a top priority.
So that is part of our global health framework, to look at those issues that I was mentioning before: lab surveillance, data, diagnostics, workforce, and we feel that what happened with COVID is something which we could use as a model to tackle other health issues, respiratory issues, but in general, many other issues afterwards. So we are using the new framework to sort of say, how do we identify a problem quickly, communicate to the people who need to know about it, and put the appropriate intervention into place, whether it's an antiviral, whether it's a vaccine if it's available. And there are many outbreaks that we see that are situations where there are vaccines already available, separate from from COVID. I mean, there are measles outbreaks out there that we, both in the United States and also overseas, where we could say, okay, let's go in there, tackle this problem, get everyone vaccinated. But it is working with the community. And one of the things that CDC does on a global front is work with those who are in the country. So we have our 60 country offices, but we need to work with those who are locally based to move things forward. In fact, CDC's image was very strong internationally. And in a lot of ways, what happened with the COVID pandemic was those in many countries turned to CDC because of the trust they had developed through our PEPFAR program, and said, what should we do about this pandemic? How do we address it? What's the information? So that is something that we should capitalize on, in the sense of using the strength and the energy that we have from that work to move things forward. And we also have incredible work with immunization programs. We have an incredible team working on global immunizations and working to basically eliminate polio as well in the world, working with foundations as well. I mean, there's so much work that we do. It's really thrilling.
Great, thank you. That's great to hear. So our next question, how is the CDC addressing the burden of non-communicable diseases, hope I said that right, which compound the impact of infectious diseases globally?
Right. So that is a very interesting question. It's a great question. There's two parts to that. One is that our chronic disease issues that surface are, as the questioner mentioned, tied to these infectious disease issues, because the underlying problem is if you have multiple chronic illnesses, you are more susceptible to some of these infectious diseases, and it really is a burden to your system. So we work with the community, with the ministries of health on all these different diseases. Now, CDC, as part of our mandate, is not to necessarily do the chronic disease work globally. It's just sort of how the structure of what our charge is, but we do work with the communities on some of these issues because we recognize that chronic disease cannot, as I was just saying, cannot be separated from some of these acute diseases. So we work with our ministries of health when they come to us and they ask us about cancer or hypertension or heart disease, obesity, you name the issue. We sort of work with them and provide advice and guidance, recognizing that by developing those relationships, when there are acute issues, as I mentioned in the talk, when there are outbreaks, they will come to us and turn to us and say, this is what we're learning from our community. So we do work together on that, but our charge in a lot of ways is some of these acute issues, infectious disease issues.
Great, thank you so much. We turn to our next question. Can you please share your insights and perspectives on having a security lens on global and public health? What is the relationship between health and health security?
So this is a great question. I mean, a lot of this is all about health security. I mean, there are so many people working on the issue of global health security. And 20, 25 years ago, it was in its infancy. People did not think about it so much. In fact, many decades ago, the White House had one office, small office. There was one person, two people there looking at this issue. And then that office disappeared, then it came back and disappeared. And now it is a very key part of the government to look at this whole issue of global health security, because we realize that if a crisis happens in a community in part of the world, then it is very likely that it will affect its infrastructure. And if its infrastructure is damaged, then the school people will leave, they'll migrate, and all of a sudden that community becomes at risk for those with less than with not the best intentions, and that creates a security issue for that community. But then there are outbreaks, and as I was saying before, those outbreaks can go from where they are all the way to America. So our best interest is to look there. In fact, they say that a disease in a little village, infection in a little village, can end up in a large urban area in another part of the world within less than 2 days. I mean, that's pretty fast given the way travel is. So global health security is really important, not only for the people in the country, as I was mentioning, but just in general for those in the United States and for anyone in the world. And sorry, I'll just add one more thing. And it has become a big issue. The State Department is looking at that. Many other agencies are looking at it. And obviously, CDC is looking at it. And of course, all of HHS.
Great. And I believe we have time for maybe 2 more questions. One moment, sorry.
Jay, I can take one from the Q&A box if you want.
Oh, great. Thank you. Sure.
As the last question to wrap up on a very light topic here, given the rise of antimicrobial microbes, can more diseases be globally eradicated the way smallpox was? And what steps do you think that we can take, to address antimicrobial microbes as well?
Sure. So the first part of that is, can we eliminate more of these diseases that are out there? And yes, we're working very hard. I mean, polio, we've done an amazing job. I mean, the dedication of multiple organizations, multiple foundations, and obviously CDC's leadership to tackle this. I mean, we've narrowed it down to a few countries with a few little outbreaks. I mean, I'm not talking about the vaccine-derived polio virus issues, but just, endemic sort of polio from the cases that we've been able to eliminate, and we work incredibly hard. So it is possible. We have to be careful because sometimes some of these viruses, they have a home in other animals, so it becomes a little trickier to tackle. But we are working to eliminate infections, and then we're also working to prevent spread of new infections. So we're very careful on watching for like H5N1, which is avian influenza, make sure we address that. If something bubbles up, we're there, we intervene, we do whatever necessary ways to prevent that from potentially spreading from animal to human. So we're working on that, obviously, very much so. Antimicrobial resistance, this goes back to many things. One is an issue of communication. I had a meeting the other day, several meetings the other day with our partners at HHS and others about how do we address the information that's out there that's inaccurate about antibiotics in general. And this is not just in the developing world, but I mean, how many times does someone go into their pediatrician's office and they say, my kid has a cold, I want an antibiotic. And then and you try to explain to them as a pediatrician that this is a virus, the antibiotic's not going to help. And then there's sometimes so much pressure. So we have to get the right information out there about that to tackle it. And then in general, we need to be sure on the global front that that we make sure that people aren't giving, counterfeit drugs and which are out there sometimes mixed with other antibiotics, and making sure the right information is given to the public in many parts of the world so that they don't end up setting themselves up for a drug-resistant organism, as I was mentioning about the macrolide antibiotics in China, and 70 to 90% resistance to that, and many other issues that are out there as well. So it's a lot, but this is where working together with everyone sort of coming together and say, I'm passionate about doing this. I'm going to make this happen. You can solve it. You can fix it.
Great. And I think we have time for one last question.
Okay.
Kind of a general one. Dr. Zucker, what keeps you up at night?
Well, I worry about some of these unknown pathogens. Like we look what happened with COVID. You're right. It's 4 years ago. I remember I was a state health commissioner at the time. I remember reading the article in one of the major newspapers and then started asking questions and calling around and started to say, this is obviously concerning. And so that was back 4 years ago. Look where we are. And so what I worry about is is there something else happening out there? And how do we make sure we identify that quickly? And then how do we work together as a community? Because you were mentioning global health security, but there's also the issue of global health diplomacy, which is that we need to be a partner on the international, but we need to stay, I should say, a partner on the international stage and work with our colleagues in different parts of the world so that information comes to us, that we can help. And when something happens, we're with them. We are with our colleagues in other parts of the world to say, okay, this is an issue that you're seeing, and we're going to help you tackle it in your country, and we're going to help you achieve it. And that's diplomacy, and that is so important. Global health diplomacy is as important as anything else that we do. And the CDC has an incredible name in the world. I mean, it's incredibly highly regarded, and I think that is something which is founded in the fact that we have incredible subject matter experts. There is not a problem on infectious disease or many areas that you can't call someone within the agency who is probably the world's expert on that, who spent their entire career looking at that. And that's why the agency gets phone calls from around the world saying, what do you know about this problem? And We want to carry that message forward. We're dedicated and committed to improving the lives of people, both here in the United States, obviously critically important, and also on the global front. And so the thing that keeps me up is like, what's out there that we don't know that's brewing, and whether it's an infectious issue or some other problem that can happen. And I'll leave with one last thing. It's like, when we started with the pandemic, everyone was sort of saying, well, kids don't get it. And then all of a sudden, these kids develop this multi-inflammatory syndrome, in children problem. And so I said to myself, you never know what's out there, what other problems are out there. And we should always have our antennas up. Not that people use antennas anymore, so it's an old dating me, but our antennas up to be listening to what problems can occur in the world. And that's pretty much one of the big issues. And what gets me to sleep is the fact that there are so many dedicated people out there working on this, and the next generation who are committed to it, that I say, people are watching out for this. So that gives me a sense of rest.
Well, I think that's all that we have time for this afternoon. I'd like to thank the audience for your questions, and of course, Dr. Zucker for this great presentation and all of your thoughtful insights today. I'll turn it back to my colleague Jacqueline to talk about our next Alliance discussion.
Thank you. So before you go, I hope you can join for our next Alliance discussion on Tuesday, January 16th at 2:30 p.m. The link to register is in the chat. Our guest speaker is Dr. Robert Kahn, the Walter Zabel Distinguished Professor and Dean Emeritus of Engineering at the University of California, San Diego, and the recipient of Research America's 2024 Gordon and Laura Gund Leadership Award. Dr. Kahn will discuss the role that American philanthropy has played in U.S. research and the unique advantages that this has provided to allow America's research sector to flourish. So thanks again for joining us today. We look forward to seeing you again soon. Have a great afternoon and long weekend. Bye.
Thank you all. Thank you.